There are a lot of myths about what you can and cannot do when you are pregnant. It can be kind of scary and overwhelming, a little bit confusing at times, especially for those first-time parents.
Right, and Judith Schuler once again joins us to clear up any misconceptions and to let us know what pregnant women should be staying away from, especially with regard to medications.
Yes.
And that's shocking. I never knew that just touching something can affect the pregnancy.
Well, you've probably seen it on TV. I haven't seen the ads recently. But we've had things for Avodart and propecia, and they say pregnant women should not touch these medications. And mainly, I mean, just touching it with your finger. But if it's broken and the medication can be absorbed into your bloodstream, it can cause problems for a fetus.
And some people may not even know what these two medications are, so
Right.
they don't know to stay away from them. Let's break down what each one are.
Okay. Avodart is a prescription medication for men to treat benign prostate enlargement. So women don't take these medications. It's a man. So if your partner or husband is taking these medications, that's how you could be exposed. And Avodart, actually, if you absorb it and it gets into your bloodstream, it can cross the placenta and affect any kind of fetus, I mean girl or boy fetus, and cause growth restriction. If it also gets into your bloodstream, and it can also affect a male fetus with abnormal genitalia development.
Wow.
So, you know, you're saying, oh, well, you know, just not big deal, but it could be. And it's not everybody who touches it or comes in contact is going to have this kind of a problem, but the risk is there.
Right, and you want to avoid all risk at every cost.
Right. And
now,
go ahead. No, go ahead.
guys, there's warnings that they're not even supposed to do certain things when they're taking those medicines.
That's right. Well, one of the things with Avodart, and this, I'll tell you, Avodart is the one that has the most warnings, should not give blood while they're taking it, because the reason is if a woman who is pregnant gets into an accident and she needs blood, or has surgery or something, it could affect the fetus.
Wow.
And the other thing with Avodart, and this is something that really should be discussed with the physician, the woman's physician, maybe the man's physician. Avodart can be found in semen. So during pregnancy, we say don't have unprotected sex, because that could, the semen in the woman's body could get into the bloodstream. The Avodart from that could get in the bloodstream and cause problems. So that is something you should not have unprotected sex if you're taking Avodart, and something you really need to talk to a doctor about, especially if you're planning a pregnancy and the father-to-be is taking Avodart.
Well, I'm glad we're talking about that one, because when, like you said, it has the most warnings that come with it. And I think it's the medication that at least I wasn't even aware what it was. I had to kind of Google it and figure out what it was for.
Right.
So this, if you see, you know what I mean, if your husband is taking it or your boyfriend is taking it, this is the thing you should be keeping at the top of your mind. Now, the propecia, that one I've heard more about.
Right. Propecia is for male pattern baldness.
Yeah.
And people say, well, Avodart, that's for older men, but a lot of older men are having children. Propecia, I know people, when I was in high school, they started going bald when they were 17 or 18. So young men may be taking propecia. And propecia is not as, doesn't have as many warnings with it. It only affects male fetuses. And again, it's abnormal genitalia development. But it's not found in semen, so there's no problem with that. And, it's a little bit less warning with it, but it should still be discussed with a physician before pregnancy, or when you find out you're pregnant and somebody's using it.
Well, and if a couple's trying to start a family, trying to plan what they're going to do, how are they supposed to plan around these medications? The hair loss medication can be avoided, but if someone has an enlarged prostate and they have to take that medicine, what are they supposed to do? That's
one of the things. A man may have to go off the medication if they're planning a pregnancy until the pregnancy is achieved. In some cases, if you know that this is going to be something a man is going to have to start taking, then you take some of the semen and you freeze it, and before he starts taking the medication.
Right.
But one thing is, if you do touch it, don't panic. What you do is wash your hands with soap and water for about 20 seconds, and that should be should take care of everything. But just be cautious. That's the thing, and find out about these medications.
Yes, always safe, better safe than sorry.
That's
Get
right.
educated.
And that's why we have Judith on. Thank you so much for
Thanks.
coming. We'll keep that at the top of mind as we're, going into different stages in our life. And if you want to learn even more about your pregnancy and Judith's series of books, just go online to yourpregnancybook.com.